Saturday. Tune into Living, 9 to 9:30 every Saturday. We got it all live for you. Yeah, so today, Saturday, and we spoke a lot about sudden death and all of those things in the last few weeks and serious issues. And today, I want to talk to you about, we do our own research here and Barbados, actually. It's a wonderful rock to be on, actually. Barbados National Registry, we'll talk about what they did. And we talk about all these studies, and you look up in the net, and a lot of them, it has to do with the demographics in the United States and Canada and so forth. But we've got our own study here on our endemic group, and I'll talk to you about that today. Heart attack and this stroke and so forth, cardiovascular problems, and spoke a little bit about that last night. Heart attack is a serious thing, and they did some studies here. In December, as a matter from July to December in 2009, with patients at the Queen Elizabeth Hospital who presented with acute myocardial infarction or acute MI or acute heart attack, whichever way you're comfortable with. 182 patients. We'll come back and talk about these things. But I want to tell you, don't forget Switch is coming out. I did 1.58 seconds last year, and this year we got Switch. Switch is extremely promising. As a matter of fact, it's on the review and the display board of iUniverse in the United States. And I have real confidence this book is going to go a far way, guys, when we're going to launch it at Lime Grove. And I should say, also Cape Shepherd. This is going to happen sometime in May, early May. I'm going to keep you updated with the dates and so forth. We got a session coming up on the 30th of April at St. Michael's School, where we'll be talking to the parents of the kids who are doing the 11 plus exams, telling you guys how to prepare them, what type of foods they should eat and so forth, so their memory would be intact and they'll do well. This is a very important exam for these kids. I'll tell them, as a matter of fact, which school they'll be assigned, and it could vary the pattern of their lives and so forth. So don't forget, the 30th, you're going to call in. I'm going to give you the number of that person you need to call. But St. Michael's School on the 30th, you know the time and all those things. But how you guys doing? How was your week? I hope you had a good week. And I know a lot of you sitting there waiting for your program every Saturday morning at 9 o'clock. We got lots of stuff for you. But I'm going to come right back after this wonderful song, and we'll talk. Before I set the stage, I know a couple of you want to call in, but I want to give you some information today. First of all, you hear the heart attack stuff, what really it is, and sometimes you got to repeat this stuff so you can get, you grow older, you have these plaques building up in all the arteries. And happens in the brain, happens in the kidneys, happens down in the legs, happens in the heart. So the plaques get severe enough eventually to get the crack. Become unstable, actually, and a blood clot forms acutely in them. It can happen from stress or any pre-existing condition or coexisting condition, or it can just happen. Blood clot goes on top of that unstable or that plaque that is cracked and completely occlude that artery. All of the muscle distal to that artery dies. So that's what a heart attack really is. The muscle of the heart dying. Brain attack or stroke, it's really the brain tissue dying, okay? So, setting the stage, we had 182 people between July in this country and December of 2009. And having said what a heart attack really is, let's go over what happens, the symptoms. Well, classically, you'll get a chest pain going to the jaw and to the back, and with sweating and shortness of breath. That's what the book says. But sometimes the illness, and most times, the illness would not follow what the textbook would say. So let's look at these 182 patients who presented here at the Queen Elizabeth Hospital, all taken, as I said before, from the Barbados National Registry. 45 of them had chest pain. 29 had shortness of breath. 17 had palpitations. 12 had sudden dizziness. 6 had headaches. 6 cough, lightheadedness, and malaise. 5 of them numbness in the fingers. Imagine that. You're just having numbness in your fingers and you're having a heart attack. 2 people. 2 people got up at night and they just was having some shortness of breath. It was a heart attack. Decreased responsiveness, 2 people. Dyspnea or shortness of breath. You know, I mean, when you walk, 2 of them. So you see, chest pain. Yes, that had the bunch, but you have shortness of breath, you could be having a heart attack or just vomiting. 17, that's a high percentage. So to present, you know, according to the statistics, 1/3 of the people with heart attack don't live for the morning, don't even make it to the hospital. Interesting stuff, huh? Sudden death from heart attack, most of it, or severe stroke, but it's all the cardiovascular nature of the whole stuff. So we have to be cognizant about these things. You know, somebody suddenly start vomiting, they're not pregnant. Why are they vomiting? Something has to cause it. Could be food, of course. But let's look at some of the history, too, of some of these people. 16% of them had a prior heart attack or some type of stroke. Hypertension lead the list, 35, which is really a high percentage. Would have had high blood pressure. 28 had the number. 28 had high cholesterol. Diabetes, 19. So obesity, 28. Hypertension, 35. Hyperlipidemia or high cholesterol, 19. And then you go on and think about alcohol, 13 of them. Smokers were 9. 3 of them were drug users and so forth. So you see how it goes. So the high blood pressure, people say, oh, diabetes is one of the major risk factors. It is strong. It's a strong. We just did this in 6 months, actually. We have diabetes. It's a terrible thing. It affects every organ of the body. But high blood pressure is all the way up there. And not to mention, apart from it causing you to have plaques within your arteries, it causes your heart to get thick and then enlarge. And then you have these big things they call dilated cardiomyopathy. And that's not good because those people are predisposed to sudden death. Don't forget 434-1791, 434-1790, 434-1771. You can call us and tell us you had a heart attack. You want to share your experience with someone out there. Yes, you can call us and we'll be happy to entertain that and give you some guidance. But don't forget, if you would have had a heart attack already, you should be an aspirin and a beta blocker. Listen to me carefully. It'll prevent you from having another one, or it'll prevent you from sudden death. If you had a heart attack and you're not an aspirin, well, if you're allergic to aspirin, you can take Plavix. But Plavix or aspirin, preferably aspirin, and Tenormin. You must be on those things, except you have some contraindication for Tenormin or the aspirin, and we could always switch you to something else. But those things, those drugs are protective. It looks like we're getting some callers. Maybe we'll take a call, heart-related, I presume. Good morning.
Hi, good morning.
How are you, ma'am? How can I be of service today?
Yes, I would like to know how would going through early menopause affect the heart?
Oh, yeah. Yeah, thank you. That's an interesting question. You know why? Because women and heart disease, I gave a talk on that the other day. But basically, women normally would not have heart disease up to menopause, which is normally age 52 plus or minus 4 years. Or if you would have had a hysterectomy where your uterus is taken out and your ovaries, then that's premature menopause. Women are protected before menopause by estrogen, which has some antioxidant and cardioprotective properties. But after menopause, what happens, you have the same risk as men for heart disease and heart attacks. I want to caution you, though, women, even though they would not have a higher percentage of heart attacks compared to men, when they do get heart attacks, they die quicker. In other words, the mortality for women with heart attacks are higher. And why? Because, of course, they come late, and they always think that heart attack is a man's thing, or only happens to men. But yes, to answer your question, a lot of flushing, a lot of your estrogen levels are low, and you have all of these flushing, and you feel like a lot of palpitations and so forth during that post-menopausal phase, and a lot of times it will make you feel like you're having heart-related problems. So it's always good to check it out. It's just the symptoms you're having. But I must say, after menopause, your risk for heart attacks and sudden death and heart disease are just like men. So I hope that would have answered your question. I want to thank you for calling. I'm going to come right back, actually. Yes, that's Rihanna. And, basically, she's our homegirl, man. She mounted to the top. Love her. What's your name? Now, listen, remember we talk about April the 30th? It's this workshop where we're teaching the parents of kids for 11 plus. It's really, I'm reading it right now. It just came through to my BlackBerry, actually. It's Barbados Public Workers Corporate Credit Union sponsoring this program, and it's going to be on the 30th of April for those people who are interested. And if you could just get in touch with Jennifer. She will tell you exactly she'll tell you exactly how you can get there. But I think the time is in the afternoon at 7 o'clock at St. Michael's School. Don't forget, okay? On the 30th. You come on by and learn so you can know what to feed these kids and how to program them and how to positively motivate them for that exam. Switched will be at Cape Shepherd, 12 to 1 p.m. on the 19th of May. It will be the book signing for Switch. And at Lime Grove on the 26th at Relish, actually Lime Grove, from 2 p.m. to 6. Those are dates you want to keep. That book, you must read it. It's a matter of fact, I touch that book every day. It's great. So we're talking, if you've got a heart attack experience that you want to share with us, you would have had sudden death, heart attack, and you came right back. You can call us, or even if you had a heart attack and you're living with it, share it with someone. 434-1791, 434-1790, and 434-1771. You can call us right now. We're going to be closing up soon, but this heart attack, as I said, is extremely deadly, and I mentioned before I left that you should be an aspirin and a beta blocker, Tenormin, whether it's metoprolol or any one of those guys. And also remember that there's something called statins. You had a high cholesterol. Bring that down. That's the plaque is commenced, actually, with cholesterol. I got some calls. I'm going to answer them right now. So statins like Crestor and Lipitor and all of those nice things. Hello, you on the air?
Yes, good morning, Doctor.
Morning, good morning.
Yes, sir. I would like to ask a question.
Please do.
Yeah, I'm diagnosed as diabetic. Some people call it diabetic 2. Where I normally take the insulin fast. As far as heart attack is concerned, what is the reason for catching cramp around the heart area?
What's the what?
The reason for catching cramp.
Oh, the cramps. You having a cramp, like your muscle cramps, or you're feeling something deep inside there?
Yeah, muscle cramp. Thickness and sometimes it gets stiff and hard and hurts a lot.
Wow. And you're diabetic, right?
Yes, sir.
Let me ask you a question. You ever had your heart examined?
Yes, sir, many times.
And everything is okay?
Well, on one occasion, I was asked the question if I ever known about having a mild heart attack. And they said it was never told.
Wow.
So I'm not sure if it...
When last you had a stress test done?
Not for quite a while.
That's the key right there, but I'm glad you called me. Don't you see, diabetics, they present atypically, meaning that it doesn't present in the format you expect. You get all type of symptoms. Remember I talked about tingling in the fingers and so forth? Yeah. Very common in diabetics. Yeah. Thank you, Cupid. I see you have a nice pen in your hand.
Well,
yes, but yeah, basically, the chest, you'll have tingling, you'll have all kind of stuff, not the normal form of presentation. So go get a stress test done. Man, I'm glad you called. A stress test will answer your questions, I promise you.
Okay.
Thanks for calling.
Thank you.
We got another caller. Good morning.
Good morning, sir.
Yes, hi.
I'm calling about my daughter, 16 plus. She always got a pain in her chest. At times she can't breathe. No, it's nothing wrong with her heart. I had ECGs and her heart is okay. But when I took her to the doctor, said she has inflammation in her chest.
Oh, how old is she?
16 plus.
Okay, gotcha. Yeah, it's something called costochondritis, where you have inflammatory process going on in your chest wall. You see the nerves run on the rib and they go into the sternum. And a lot of times, is she athletic?
No. Oh, God, no.
She's not. Is she obese?
No.
Okay, good. Yeah, but a lot of times a lot of times it happens with athletes, but other people, you have these pains in your chest wall that really is from the nerves being irritated down there, and some anti-inflammatory agents would help significantly. You take it for 3 weeks, and you're surprised to see the results. They're not, the one that I like, as a matter of fact, is Cataflam. But Arcoxia is coming as one of the best, especially for these younger kids. 1 tablet a day, Arcoxia. Ask him for that. 3 weeks. It'll take away the inflammation. She should be fine. But get her involved in exercising, okay?
She's not an outgoing person.
Yeah, let her ride a bicycle at home. Buy a treadmill for her. Do something like work with her.
The thing is, right? Every couple months, this thing reoccurred.
Yeah, reoccur, huh?
Yes. So,
yeah, let her. She ever had something called an echocardiogram?
No.
That's it. Go get one. You might see, is she slim?
Yes.
Yeah, it might be something called mitral valve collapse. Maybe that's where it is. An echocardiogram will answer your questions for you. Thank you for calling.
You're welcome. Thank you very much.
Yes, guys, we're getting up there close, so I can't take any more calls today, but the registry showed that at least 1/3, 30% of these people died before even getting to see the doctor. So, heart attacks is serious stuff, all right? I want to say, in going forward, if you're with your loved one and you find for some reason they're just laying in bed and having a problem, there's something called a precordial thump. I said it before many times, where you just take your fists and you hit them in the chest. I would do that while you're calling the ambulance. Hit them quickly in that chest, like punch them in the center. It's like a jump start to the heart. A lot of times, 95.3% of the times when patients suddenly would die, it's because of ventricular fibrillation, where your heart is going at 500 beats per minute. And one sudden hit to the chest stops it and give time for them to get to the emergency room. Precordial thump. You just look into the in the internet and you'll read about that. But it's important, something to do, all right? So I want to thank you. Don't forget Switch is coming out, and don't forget the 30th of April. We have that stuff going on for the 11 plus. Amy Whitehouse, she love is a losing game. And I'll see you guys next week.